How's it going, guys? Medium difficulty question, hematology, biochemistry, 41-year-old woman, 4-month history, progressive blistering lesions, backs to the hands, 3 beers nightly after returning from work at a rifle factory, physical exam shows hyperpigmentation, blisters on exposed areas, laboratory studies show transaminitis, hemoglobin normal 15 should be 12 to 17.5, menstruating women, 13 to 17.5, non-menstruating women and men, MCV normal at 90, should be 80 to 100, urinary porphyrin is detected, shouldn't be there. What's the most likely explanation for patient findings? Choice A, deficiency of delta aminolevulinic acid, ALA synthase, valine precursor alcohol-induced, wrong fucking answer. This refers to nothing. Okay, so the first step of heme synthesis, you're going to have succinyl-CoA plus glycine via delta ALA synthase, and vitamin B6 goes to delta ALA. Deficiency of delta ALA can be X-linked recessive. It can also be alcohol-induced. I've seen moonshine, which is 100% alcohol, show up in NBME question. So if you have inhibition of delta ALA synthase, that's sideroblastic anemia. So as I said, X-linked recessive, or it can be sporadic, just usually due to alcohol. And you're going to get sideroblasts, which are precursors to RBCs that have iron-laden mitochondria surrounding the nuclei that's stained with Prussian blue. So you'll get an image very buzzy with blue dots on a blood smear in various cells. You're like, this is a little bit weird. I don't know. It's just very buzzy for sideroblastic anemia. So choice A is nothing because valine's irrelevant. Just threw it in here as it's clearly a wrong answer. Wrong fucking answer. Choice B, delta LA, synthase deficiency, succinyl-CoA precursor, B6 required, wrong fucking answer. This isn't sideroblastic anemia. Wrong fucking answer. Choice C, deficiency, delta ALA, dehydratase, glycine precursor, wrong fucking answer. Okay, you could see this with lead poisoning. So we said before, glycine's precursor to delta ALA, which in turn is our heme synthesis pathway. So glycine is technically correct if we had a precursor here, but lead inhibits delta ALA dehydratase as well as ferrochelatase, the last enzyme in heme synthesis. They want you to know that for step 1 in particular, okay? These heme disorder questions show up everywhere. Exceedingly high yield for heme biochem. Wrong fucking answer. Choice D, deficiency, porphobilinogen deaminase, valine precursor. Nonsense answer choice, wrong fucking answer. Okay, so deficiency of this enzyme is going to cause acute intermittent porphyria, which I'll talk about in a second, but valine, once again, has no role in heme synthesis. Wrong fucking answer. Choice C, acute intermittent porphyria, succinyl-CoA precursor, wrong fucking answer. So the reason acute intermittent porphyria is wrong is because that's going to be classically abdominal pain. You can get red urine, pink urine. It's usually autosomal dominant. They assess autosomal dominant inheritance for that on an offline NBME. Sounds extremely nitpicky, and I agree that it is, but it shows up. So alcohol can induce episodes of the abdominal pain. You get neuropathy as well, and you can get depression. I made a psych question on the YouTube here. Very rare that I ever make psych questions, but it shows up on a form for 2CK in particular that you need to know. Psych issues, depression are high yield for acute intermittent porphyria, not just the neurologic issues. So acute intermittent porphyria, glucose and hematin can treat. Wrong fucking answer. Choice F, deficiency of uroporphyrinogen decarboxylase, glycine precursor, correct answer. So diagnosis porphyria cutaneous tarda. This is the answer when you got a heme synthesis disorder with photosensitivity. Okay, it can be autosomal dominant, but 80% tend to just be sporadic, and it's progressive blistering condition. Okay, and you can sometimes get tea-colored urine, but it's going to be very simple. What they're going to do, give you a vignette just like this, and say which the following is a precursor to this patient's condition. The answer is just succinyl-CoA, or the answer is just glycine. Okay, so as I said, it sounds very nitpicky, the biochemistry, if you're not familiar with it, all over the NBME exams. Okay, so this is the only one that works. You say, I know this is the enzyme that's deficient in this condition, so I instantaneously eliminate all of them. It's the only one that makes sense. And yes, glycine as precursor is convenient, or succinyl-CoA. So Finally, inhibition of ferrochelatase, wrong fucking answer, as I already discussed. This would be lead poisoning. And I decided to be an asshole, said that the patient works in a factory. They can say bullets, working with bullets, a hunter. Okay, and the way you know in adults, lead poisoning will classically give you a microacidic anemia. That's why I gave you the normal MCV and normal hemoglobin here. So it's not just going to be a 2-year-old eating paint chips in a house. Ferrochelatase, wrong fucking answer. You know the deal. I'm to make more content on my subscribe channel. Appreciate your time. That's it.